Hey guys, this is VJ, and this is your PSA on squamous cell carcinoma. What is it? It's a type of skin cancer classified as non-melanoma skin cancer. There are two types of non-melanoma skin cancer. One is basal cell carcinoma, and this one, which is squamous cell carcinoma. The definition of a skin cancer of this category is an uncontrolled growth of abnormal cells arising in squamous cells. This may occur on all parts of the body, including mucous membranes and genitals, but most commonly in areas exposed to the sun. Some signs and symptoms of this disease is scaly red patches, open sores, warts, elevated growth with central depression, occasional skin bleeding. As you can see in the picture at the bottom right, this is a patient who has squamous cell carcinoma. Who gets it? Anyone with a history of substantial sun exposure is subject to squamous cell carcinoma. Another fact is that it's twice more frequent in men than it is in women. Generally, people with fair skin, light hair, or blue, green, or gray eyes is more subject to squamous cell carcinoma than others. Some causes of squamous cell carcinoma is 1. Chronic exposure to sunlight, 2. Frequent use of tanning beds, 3. Infections and skin inflammations, 4. Immunodeficiency viruses, and 5. Inheritance. Immunodeficiency viruses will weaken one's immune system and therefore make him or her more vulnerable to squamous cell carcinoma. And it is also a heritable disease. Therefore, if a family member from the previous generation had squamous cell carcinoma, you may also be subject to this disease. Some available treatment are the following: Mohs micrographic surgery, excisional surgery, curettage and electrodissection, also known as electrosurgery, cryosurgery, radiation, and laser surgery. In Mohs micrographic surgery, a physician uses a scalpel or a curette to remove the visible tumor with a very thin layer of tissue around it. This layer is immediately checked under a microscope thoroughly. If the tumor is still present in the depths of the peripheries around the surrounding tissue, the procedure is repeated until the last layer viewed under the microscope is tumor-free. Mohs saves the greatest amount of healthy tissue, and it appears to reduce the rate of local recurrence. It has the highest overall cure rate of all the potential cures, which is about 94 to 99%. In excisional surgery, a physician uses a scalpel to remove the entire growth, along with the surrounding border of apparently normal skin as a safety margin. This wound around the surgical site is then closed with stitches. The excised tissue is then sent to the laboratory for microscopic examination to verify that all cancerous cells have been removed. The accepted cure rate for primary tumors with this technique is about 92%. In curettage and electrodissection, also known as electrosurgery, the growth is scraped off with a curette, which, as is also used in Mohs micrographic surgery, is a sharp ring-shaped instrument. So the growth is scraped off with a curette, and burning heat produced by an electrocautery needle destroys residual tumor and controls bleeding. This procedure is typically repeated a few times, and a deeper layer of tissue being scraped and burned each time to help ensure that no tumor cells remain. It can produce cure rates approaching those of surgical excision for superficially invasive squamous cell carcinoma without high-risk characteristics. However, it is not considered as effective for more invasive, aggressive squamous cell carcinomas or in high-risk and difficult sites such as the eyelids, genitals, lips, and ears. In cryosurgery, the physician destroys the tumor tissue by freezing it with liquid nitrogen using a cotton-tipped applicator or a spray device. There is no cutting or bleeding and no anesthesia required. This procedure may be repeated several times at the same session to help ensure destruction of all malignant cells. Their growth then becomes crusted, scabbed, and usually falls off within weeks. Redness, swelling, blistering, and crusting can occur to the patient who is under this treatment. And in dark-skinned patients, some pigment may be lost. This method of treatment is inexpensive and easy to administer. Cryosurgery may also be the best treatment choice for patients who have bleeding disorders or intolerance to anesthesia. However, it does have the lowest overall cure rate of the surgical methods. Radiation is the next method. X-ray beams are directed at the tumor with no need for cutting or anesthesia. Destruction of the tumor usually requires a series of treatments administered several times a week for 1 to 4 weeks, or sometimes daily for 1 month. Cure rates range widely from about 85 to 95%, and the technique can involve long-term cosmetic problems and radiation risks, as well as multiple visits. Finally is laser surgery. The skin's outer layer and variable amounts of deeper skin are removed using a carbon dioxide or erbium YAG laser. This method is bloodless and gives the physician good control over the depth of the tissue removed. It actually seals blood vessels as it cuts, making it useful for patients with bleeding disorders and also sometimes used when other treatments have failed. But the risks of scarring and pigment loss are slightly greater than with the other techniques. This is the source I used to gather my information. It was skincancer.org. Thanks, and I hope this PSA helped you guys learn a little bit more about squamous cell carcinoma.